Hello, students. Welcome to Chapter 20, Diabetes Mellitus, Part 4, final part of the chapter. So we're going to review the carbohydrate counting for clients using rapid-acting or regular insulin at meal times, right? Carbs counting provides an option to balance carbs intake with insulin needs for a particular meal. It also provides flexibility in carbs intake because individuals match the insulin to the specific amount of carbs they choose for that meal. After summing up the total carbs planned for the meal, individuals then calculate insulin needs based on their insulin to carbs ratio. Okay, and also they need to start practicing and getting to the habit to read the nutritional facts level so they can calculate the carbohydrates, right? Insulin and insulin to carbs ratio is a complex process that requires the client to have advanced health literacy and numeracy to use successfully. So the ADA, that the website of the American Diabetic Association, and the ANT, right? The www.eatingright.org provide nutritional information and toolkits for meal planning based on carbohydrate counting techniques. But to be safe, the first steps I would recommend to be done by a registered dietitian, so they can show the patient how to do this count, the carbohydrate counting versus the insulin ratio, that which is a very important. Okay, so the exchange system, that's good to know. The food exchange method can help in dietary management of diabetes. There is another one, which is the exchange system. It's another method used, although infrequently, to help individuals match their insulin dose to their carbohydrate intake. So the dietitian typically calculates the person's energy and nutrients needs and creates a customized meal plan. That's step one, right? First is to calculate the amount of calorie based on the nutrient needs that the patient requires. Commonly used foods are grouped into exchange lists based on roughly equal macronutrient values. So we are talking about proteins in one section, fats in another section, and then carbs in another section, right? And then the exchange list includes defined portions based on macronutrient content for carbs, meat, fats, and alcohol, included alcohol. Huh? So the individual then chooses a specific number of exchange at each meal, and the use of carbs counting has mostly replaced this method of meal planning for those with diabetes. So healthy eating patterns, the concept of prescribing a specific diet for people with diabetes no longer exists. Okay, there is no a specific diet, 7 days, 15 days. The people cannot live based on a written diet. They need to have knowledge, and they need to understand how to make the combinations, as we were mentioning before. There are several acceptable eating patterns for individual managing pre-diabetes and type 2 diabetes. The Mediterranean diet, the DASH diet, and plant-based eating patterns are a few long-standing examples that produce positive results in research, right? So a combination of all the nutrients works much better than eliminating carbs from the diet, which is, I don't think, probably can work 1, 2 weeks, 3 months, but in the long run, it's not going to be successful. Emerging evidence indicates that following a low carbs or very low carb diet eating pattern may improve your A1C levels in individuals with type 2 diabetes over a 3 to 6 months time frame. However, this benefit is attenuated at 12 and 24 months. Yes, so it can work at the beginning, but close to 2 years, it's not going to be easy to follow, or probably the body is going to be adapted and to different habits. So I don't think it's going to work. The low carb plan is not recommended for those individuals who are pregnant, lactating, or at risk or disorder eating, or for those with renal disease, right? The low carb, because in that type of diet, the patient is going to eat more protein, and that is going to damage the kidneys, as we spoke before. So you need to remember that avoid low carb diet in pregnant, lactating, and eating disorder or renal disease. And so, what else? What else? What else? Where are we? As current evidence does not indicate that one eating pattern is preferred over another, there are a few key messages that healthcare team relay to the clients as follows. One, include non-starchy vegetables at most meals. Non-starchy vegetables must be included in all meals. And then to minimize the intake of refined grains and added sugars, and then avoid highly processed foods by choosing whole foods instead. So here there is a website where we can see, and this is the, I would say, the most important part of the chapter at the end, because everything is summarized nutrition, right? Non-starches versus starches, right? So then we have here a list. What are starchy and no starchy vegetables, right? And here we have typically non-starchy vegetable contain roughly the following serving of half cup cooked or 1 cup raw without another fat. So the list of non-starchy vegetables: your artichokes, asparagus, Brussels sprouts, broccoli, cabbage, celery, chicory, cucumbers, dandelion leeks, all these. Also, lettuce and greens are in the non-starchy category. Your endive, kale. Wow, you guys should try the endive. It's so delicious, so amazing, so crunchy. Spinach, um, and some non-starchy red and orange vegetables are your carrots, your pumpkins, snow peas, your sweet potato is a non-starchy, and tomatoes. Beans, pea, and legumes on the non-starchy list includes bean sprouts, green beans, Italian wax beans, other non-starchy, avocado, basically most of the vegetables, right? Your onions, water chestnuts, mushrooms. Now, I think it's better to try to memorize the starchy vegetables, because the non-starchy are too many, right? Where is this? I don't know where is this coming from. Okay, so your starchy vegetables, you have your beets, your cassava, corn, green peas, plantains, potato, parsnips. Okay, your butternut squash is so delicious, but it's a starchy vegetable, so it's better, right, to stay away from these starchy vegetables. You get from these varies on how they are cooked. Yes, so it's not only the starch itself, but how you cook them. They are healthiest if you bake them, steam it, boil it, or microwave. I wouldn't recommend microwave to get away from the radiation. Broil or grilled. So if you fry them, then there is a problem, right? So here is the very wellhealth.com, starchy vegetables. You can access that. And let's move to additional concerns. Okay, so special diet food items. Healthy eating patterns primarily include fresh food, whole foods, and limit processed food. So that's why we need to work with the patient in try to accommodate the schedule, in order for to have time to prepare for this type of diet, right? It's all about planning, as we mentioned before. alcohol, the guidelines for alcohol use for people with diabetes or pre-diabetes follow those for the general population. 1 drink or less per day for adult women, and 2 drinks or less for adult men. In general, I will strongly recommend to avoid drinking, right? Individuals using either insulin or insulin secretagogues, which are your other type of medication, must monitor their blood glucose carefully because alcohol increases the risk for delayed hypoglycemia. Wow, what a nice piece of information. Alcohol increases the risk for delay hypoglycemia. So the hypoglycemia is going to be present for a long period of time. Equivalent portions of a single alcohol serving are 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of 80 proof whiskey. The problem with alcohol is that whenever you start with 1 glass, then you want to keep going, right? So not everybody has the control to stop. And if you are in a social event, probably the group and the interaction with other people is going to motivate you to keep drinking. So okay, a person with type 1 diabetes should not substitute alcohol for carbs options in meal planning. So a person with type 1 should not substitute alcohol for carbs option in a meal planning. Okay, sometimes they say, okay, I'm gonna get this glass of wine, but I'm not going to eat the, let's say, the French fries, right? So when a person's blood glucose level begin to drop, the liver typically responds to the hormone glucagon and releases glucose into the blood to reestablish normal blood glucose levels. So we understand this concept already, right? The mechanism of action of glucagon, the liver, and the release of glucose. However, with the consumption of alcohol, the liver detoxifies the blood of alcohol and suspend the normal response to impending hypoglycemia until it has cleared the alcohol. Oh, okay. So when alcohol is present in blood, the liver is going to hold the release of glucose. So hypoglycemia is going to stay there for a longer period until the blood gets rid of the alcohol. What is very dangerous this, huh? This is very dangerous. That's when alcohol consumption occurs slowly, in moderation, and with food, it minimizes the risk of hypoglycemia. So when alcohol consumption occurs slowly, so you are drinking little sips of alcohol in moderation and with food, not only alcohol, but you are getting sips of wine and you are eating at parallel, right? The risk for hypoglycemia is less than if you are only consuming alcohol. So the liver is not going to release the glucose in case of hypoglycemia. Using alcohol in cooking poses less concern because the alcohol vaporizes in the cooking process and contributes only to its flavor to the finished product. Yes, so it's safer to use the alcohol for cooking wine, for a wine reduction or on a steak or something like that. Okay, so in summary, that's good to know. Alcohol can alter liver function in hypoglycemia. Wow, this is dangerous. Okay, hyperglycemia. The brain depends on a constant supply of glucose for metabolism and proper function. We know that. A prolonged lack of glucose can lead to brain damage. We know that. We review that. Classifications for hypoglycemia are defined as follows. Level 1 is a blood glucose between 54 and 70, being 70 the borderline for normal glucose, right? The minimal, 70 is the minimal, right? And level 2 is less than 54, And level 3 is a severe event characterized by needing assistance from another person regardless of blood glucose level. I've seen a patient on 25, level of 25, completely unconscious, rigid, um, cold. It was like a piece of furniture, really, when I found this patient, and we have to call the EMT, and they came and they had to administer, I think they give dextrose IV or something like that. Okay, so box 20.4, sample healthy eating pattern. For example, if a patient is going to have a diet of 2,250 kilocalories. So 45% of that calorie is going to be 55 grams of carbohydrates. So 45% carbs, 20% is going to be protein, like 110 grams of protein, and 35% is going to be fat, 88%, 80 grams of fat. So that's good to know. Diet for diabetic patients are going to be 45% carbs. We are summarizing, right? 20% protein and 35% fats. For example, um, let me round the numbers. If a patient is eating a diet of 2,000 calories, I'm using these numbers instead of 2,250. A day, must get 900 calories from carbs, which is equivalent to the 45%, right? So 10% would be 200, 200 and 200, it would be 20%, another 200, 30%, 600, and another 100 would be 800, would be 40%, right? And then if we want to reach 45, then we add 5%, which is 100. So it would be 900. So you make your mathematics somehow like that. And then for breakfast, this is a very nice example. A cup of whole strawberries. You remember I mentioned strawberries, any type of berries are low fructose. 2 slices of whole wheat toast, and two scrambled eggs with spinach and tomato. Wow, delicious, this diet, right? And a quarter of avocado, and coffee or tea without sweetener. So this is very similar of one of my breakfasts. Very similar. Strawberry, the whole wheat, scrambled eggs, spinach, and tomato. Sometimes I put bell peppers or onions. Okay, 1/4 of avocado. I have to work on that because we love avocado here at home, so I usually put half avocado. And then for lunch, your green salad with cucumbers, baby carrots, cherry tomatoes. You see all your non-starchy vegetables. 1 tablespoon of Parmesan cheese, and 1.5 tablespoon of balsamic dressing. Oh, delicious. And then you have your tuna sandwich on 2 slices of whole wheat bread, and you put the tuna, half cup drained with mayo, 1 tablespoon chopped dill pickle, chopped celery, and 1 medium fresh pear. This is delicious. I wouldn't be bored at all. And then for dinner, your pan broiled pork chop, well trimmed, 1 cup of oven roasted potatoes. There you have a starch there, but it's roasted. You see, it's not fried. 1 cup of grilled mushroom, bell peppers, and tomatoes. Excellent. A cup of toasted spinach, romaine lettuce, tomatoes, pepper. Excellent. Full vegetables. Balsamic salad dressing, and one large glass of water. So the diet also includes a snack and an evening snack. Excellent, excellent. And then hypoglycemic event occur because there is too much insulin or oral hypoglycemic medication in the body relative to the blood glucose level. So hypoglycemia occur again because there is too much insulin or oral hypoglycemic medication in the body relative to the blood glucose level. So any form of diabetes medication, diabetic identification, sorry, any form of diabetic identification is required. Bracelets, pendant, other item helps prevent these mistakes and helps with proper treatment of hypoglycemia, right? Because sometimes we don't know what is the status of the patient, but if we can identify that the patient is diabetic, right? We can basically treat based on the symptoms. And sometimes and these patients with hypoglycemia, they can have the fast acting glucose source or injection of glucagon. So people with diabetes and using insulin or insulin medications need to plan for unexpected hypoglycemia events and carry a convenient source of fast acting glucose. Yes, there's always need to be something in the in your bag. The rule of 15 states to provide 15 to 20 grams of fast-acting glucose, checking glucose level 15 minutes later, and if blood glucose is less than 70, repeat as needed. So during a hypoglycemic event, people with diabetes should not use food sources containing fat, as it slows down the absorption of glucose into the bloodstream. So in case of hypoglycemic, don't get fat snacks because this slow down the absorption of glucose. So similarly, protein is also avoided because protein increases insulin response without increasing glucose level in some individuals. What we are looking in a hypoglycemic event is to increase the level of glucose, right? So that's use neither fat or protein to treat hypoglycemia. Again, remember this. Don't use protein, neither fats to treat hypoglycemia. And then symptoms of hyperglycemia and hypoglycemia. I love this table. So the cause, for example, is too much food, not enough insulin, illness, some medications, or stress. Those are going to be the causes of hyperglycemia. Again, too much food. Remember, the patient with diabetes is going to be with polyuria, which is excessive urination, polydipsia, thirst, and polyphagia, which is eating a lot. That's why it's excessive food, right? And probably the patient does not have enough insulin to balance out that intake. In terms of hypoglycemia, the cause could be not enough food, okay, too much insulin, or too much exercise or alcohol intake without food. And we understand why alcohol can be the cause of hypoglycemia. And then the symptoms in hyperglycemia: polydipsia, polyuria, polyphagia, dry, itchy skin, blurred vision, confusion, right? To the point that sometimes patient is going to tell you, let me give you an example of somebody that I know. For example, a diabetic patient could be driving, right? And is listening to the music, is driving, and there is a pilot, in the car with him. So he's doing 4 activities in one. Dr. Matalana, what 4 activities? He's driving. He's driving. He's listening to the music. He's talking to the pilot, and also he's checking the signs in the road. So it's 4 activities, right? And that patient is going to tell you, listen, I can do only 2 things, maybe the most 2 things. So I can drive and read the signs, turn off the radio, and don't talk to me, because he cannot handle these 4 things that other regular person that is not diabetic could do, right? So that's the confusion of the hyperglycemia. And then patient with hypoglycemia is going to be shaking, nervousness, sweating cold, anxiety and irritability, and palpitation is going to happen also because they feel that the sugar is going down. That's why they start shaking. Dizziness, impaired vision, headache, hunger, confusion as well. Okay, so this is a very interesting chapter. I hope you can listen to these videos and watch these videos multiple times because it's not easy. And I really ask you to master this for your NCLEX and for your practice. So here is the case study. Okay, and also, okay, we have illness. Recommendations include that individuals with diabetes receive an annual influenza vaccination plus other preventive vaccines as indicated. Remember that patients with diabetes, they are going to have infections, right? So because bacteria, viruses, fungal, and parasites, they love sugar, so they are in risk for infections. So pneumococcal vaccine, hepatitis B vaccines are required. Modifying the texture of food or using liquid forms may help with the continual intake of carbs during illness. In general, people with diabetes experiencing short-term illness like cold, flu, vomiting, diarrhea should do the following. Number one, monitor glucose levels more frequently because fever, infection, or stress hormones can raise glucose levels. Again, fever, infection, or stress hormones, right, related to stressful events can raise glucose level. Remember what I told you about the patient having the mother in hospice, and the patient was following the diet, taking the medications while taking care of the mother in hospice care, but the sugar went all the way to 500 with partial facial paralysis. I'm telling you, stress can elevate your glucose levels. So possible adjust their insulin dose, right? Depending on the recommendations. Number three, monitor urine for ketones is a sign of DKA. Number four, maintain food and fluid intake, replace lost fluids, because remember they are going to be kind of dehydrated because they are having polyuria, they are urinating, they are getting rid of the sugar, right? And the body itself is going to ask you for more water, 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 because they are going to be thirsty, dehydrated. So you need to replace fluids, carbs, and electrolytes, of course, with the polyuria. Liquid or soft foods may replace solid carbs. Food is necessary. Okay. And contact a PCP if illness lasts for more than 24 hours. In terms of traveling, the patient needs to review how to choose healthy options. That's why education is so important, to let the patient select the food, be able to master the knowledge to choose what he's going to eat in different countries, right? Carry healthier snack options and items that travel well: nuts, small piece of fruit, cheese, whole grain crackers, a quarter cup hummus and vegetables. Those are the snacks. It's not chocolate, it's not candies, right? Bring fast acting glucose option in case of hypoglycemia. And educate traveling partners on signs, symptoms, and treatments of hypoglycemia. Yes, you see, I told you about the incident in the airplane when I had a person sitting next to me with a hypoglycemic event, right? Wear identification bracelets, necklaces, or another item. In terms of eating out, prep planning is the key. Selecting restaurants with fresh, less processed option and appropriate portion size assist in following a healthy eating pattern. Remember that it's all about portions instead of receiving a diet from a nutritionist that you cannot follow if you're traveling, if you are working. So it's all about patient education, constant patient education. For individuals using mealtime insulin, understanding carbs content and various foods helps to match their insulin dose correctly. Another important consideration is the timing of the meal and insulin dose to avoid either hypoglycemia or hyperglycemia. And stress. Physiological or psychological stress affects glycemic management in individuals with diabetes due to the hormone responses that are antagonists to insulin. Again, the hormones that are antagonists to insulin. Additionally, diabetes distress is common. And the main difference between stress and distress is that stress is a human response shown towards external or psychological stressors, while distress is the emotional state a person encounters when he fails to adapt himself to stressors. So that is the difference. And in that case, the nurse must be aware of these behaviors, right? You need to identify, you need to help the patient, not only bombarding the patient with instructions, nutritional facts, training for the insulin injections, for the monitoring, this and that, but also referring the patient to psychological um, uh, advice, right? Diabetic specific emotional stress correlates for higher A1C. A specific emotional stress, higher A1C values, and less healthy lifestyle choices. Stress reduction exercise help people with diabetes manage their self-care and glucose levels. So you can talk about different type of meditation, walking, listening to the music. You need to, and the stress also is going to cause high blood pressure. So, and many other diseases and conditions. So prefer stress reducing activities vary greatly from one person to the next. Medications, running, yoga, journaling, playing music. Yes. So that's very important. Ladies and gentlemen, we have concluded chapter 20 related to diabetes mellitus. And we finished this part 4. Try to review when possible. This chapter is extremely important in healthcare in the United States and for your family and friends. Okay, thank you so much for your attention. See you next time.